Hello and welcome to Insight Ophthalmology. This is Dr. Amrit, welcoming you to another lecture. Today we are talking about the detailed anatomy of the vitreous. The vitreous is basically derived from the Latin word vitrum, which means glass-like. Now, the vitreous humor is situated and it is bounded anteriorly by the ciliary body, zonules and the lens, and posteriorly it is bounded by the retina and the choroid. It is an inert, transparent, gel-like, colorless hydrophilic substance which serves basically the optical function of the eye. Moreover, it supports the eyeball from inside, which is known as the internal tamponade. That means it is actually one factor that keeps the retina or the neurosensory retina attached to the retinal pigment epithelium. The vitreous is basically the largest cavity inside the eye and it forms about 2/3 of the volume of the eye. It is about 4 grams in weight and 4 cc in volume. First, let us talk about the constituents of vitreous. That means what is vitreous basically formed of? The vitreous humor is basically formed of about 98 to 99% is water and 2% is the structural proteins. Now when we talk about the proteins, the major protein over here is the collagen and specifically it is the type 2 collagen. Now this fine diameter type 2 collagen basically is entrapped in the large coils of hyaluronic acid molecules. Okay, so apart from the structural proteins, there are also some extracellular matrix components within the vitreous, and these are the hyaluronic acid, chondroitin sulphate, opticin, vitreous 1 protein, and fibrillins, right? So as you can see in this diagram, so we have these thin fibers, which are the thin structures which are known as the fibrils. Okay, and these fibrils are going to be coiled together to form the fibers, and the fiber structure of the vitreous is formed from the is basically derived from the collagen. Apart from that, you can see over here this extracellular or outside the fibrous structure, what do we have is the extracellular matrix, and that is formed majorly by the hyaluronic acid. Now, this hyaluronic acid has the capacity to basically trap water inside it. Okay, so apart from that, we have some cells in the vitreous which are known as hyalucytes. So as we move ahead with the lecture, we are going to actually discuss about all of these in detail. First, the water component, as I told you, the vitreous is 98 to 99% water and the refractive index of the vitreous is about 1.33. However, the viscosity of the vitreous gel is about 2 to 3 times that of water, making it a gel-like structure. Okay, and also this viscosity actually depends upon the concentration of the sodium hyaluronate or the hyaluronic acid or the extracellular matrix, because it is this extracellular matrix which is going to hold water inside it. Okay, so now let us talk about the vitreous collagen. So the collagen basically forms the major structure of the vitreous. It gives that structural form to the vitreous gel, and in the vitreous humor we basically have 3 different types of collagens. We have type 2 collagen fibrils, which are the major structural component of the fiber. Then we have the type 9 collagen. Okay, now type 9 is basically found on the surface of the type 2 and it basically shields the type 2 collagen fibrils and prevent them from fusing together, leading to condensation of the vitreous collagen. Okay, so just wait for a while and I'll explain to you what does this mean. Apart from that, we have type 5 and type 11 fibrils, which are located inside the core of the collagen fibers, and it is believed that they participate in the initial stages of fiber formation. So let us try to understand this collagen structure using this diagram. Okay, so now in this diagram, the thin filaments that you see, they are known as the fibrils. Okay, and these fibrils are then, when they actually coil together with other fibrils, they will form what is known as a fiber. Okay, so a fibril is basically a smaller unit and a fiber is formed by numerous fibrils joined together. Okay, now the most common type of collagen that we have in vitreous is the type 2 collagen, and the type 2 collagen over here is depicted in the red color, or you can say the pink color, whatever it is, right? So the red color structure here is the type 2 collagen, which is forming the major structure of the vitreous, and it accounts for about 3/4 of the total vitreous collagen. Apart from that, the blue structures, the blue fibrils that you see over here are basically the type 9 collagen. And as you can see, the type 9 collagen is basically present on the surface of the type 2. And it is proposed that these type 9 collagen are actually preventing the type 2 collagen from getting degenerated, or it is basically preventing the vitreous condensation as well. Okay, so the type 9 collagen basically has this protective mechanism or protective function. Apart from that, you can see over here drawn in purple are the type 5 and type 11 collagen, and if you see carefully, they are present within the core or within the center of this fiber, collagen fiber. Okay, so since they are present in the center, it is believed that the initial process of fibrillogenesis, that is the initial process of making of these fibrils, basically starts with the laying down of the type 5 and type 11 collagen, and later the other collagen molecules are, other collagen fibrils are laid on top of it, whether it is type 2 or type 9. Okay, so with this we complete what is meant by the collagen and what are the various types of collagen within the vitreous humor. So I hope that is clear. So type 2 collagen, type 9 collagen, and type 5 and 11 collagen, right? So in this diagram, you can see how the fibrils have joined together to form these bundles of collagen, and these bundles are actually interconnected and they're giving that major structure to the vitreous humor. Apart from that, you can see extracellular matrix, which has a lot of proteins, but the major one is the hyaluronic acid, and within that coils of the hyaluronic acid, you have water molecules which are entrapped in it, and almost about 98 to 99% of the vitreous is majorly water. Okay, so now we're going to talk about the vitreoretinal interface. Very, very important. So what is really meant by vitreoretinal interface? The point where the vitreous is going to join with the retina is known as the interface between the vitreous and retina, or the vitreoretinal interface, right? So as you can see over here, the innermost structure of the retina is the internal limiting membrane, or the innermost layer is the internal limiting membrane, and the outermost layer of the vitreous is known as the cortical vitreous. So we'll talk about the topography and the layers of vitreous in a while. So the junction between the two is known as the vitreoretinal interface. So the interaction between the collagen molecules which are present in the periphery of the vitreous with the internal limiting membrane of the retina is mediated by these special macromolecules which are fibronectin and the laminin. Okay, and it is because of these dense adhesions which are formed because of the fibronectin and laminin, we have nice adhesion between the vitreous and the retina. So if you get a question as to what do you find at the vitreoretinal interface, it is basically the fibronectin and laminin. Now, another thing that I want to talk about is a type of collagen that you see at the vitreoretinal interface. Now, in some textbooks, it is given that at the vitreoretinal interface, you have type 4 collagen in abundance. Okay, so I hope that is clear. Now, here you can actually see an OCT image which is showing you the same thing, that usually the vitreous and the retina are basically in close adhesion or attachment with each other. However, with age and in some pathological conditions, what happens is that the vitreous starts separating from the retina, and as the vitreous starts separating from the retina, that condition is known as vitreous detachment. Okay, so you can see over here, normally there should be no gap, but over here, as the vitreous has started to separate from the internal limiting membrane, so over here is the internal limiting membrane, and this hyperreflectivity that you see is basically coming from the posterior vitreous, and to be more specific, it is coming from the posterior hyaloid. So in a while, I'm going to tell you what is exactly meant by the posterior hyaloid. Okay, so this OCT over here again is showing you what is meant by the vitreous detachment, right? So I hope it is clear now what is meant by vitreoretinal interface and what is posterior vitreous detachment. Now, this would be a correct time to discuss about a clinical nugget regarding the Stickler syndrome. Now, Stickler syndrome is basically a multi-system disorder where you have this autosomal dominant inheritance, and the problem is with respect to the type 2 collagen. Now, I told you that the type 2 collagen forms a major bulk of the vitreous, and definitely if you have a disorder where the type 2 collagen itself is defective, definitely your vitreous will not be in its normal formed state, right? And therefore, these individuals who have Stickler syndrome, they are at a greater risk of developing giant retinal tears and retinal detachment. So over here you can see that this is a patient with Stickler syndrome who actually has this big tear over here. This is giant retinal tear folded on itself, and you can see over here this is the bare retina, and the tear actually has folded on itself, right? Now, the vitreous basically in these patients of Stickler syndrome is not fully formed because of the problem with the type 2 collagen, right? Now, based on the phenotype of the vitreous that you see in Stickler syndrome, we have two different types. We have Stickler syndrome type 1 and Stickler syndrome type 2. Okay, so in Stickler syndrome type 1, the mutation is present in collagen 2A1 gene, and here the phenotype of the vitreous that you see is known as the membranous vitreous. Now here you can see these membranes which are seen on a slit line examination behind your lens. Okay, again here also you can see these membranous structures behind the lens. Okay, so this is known as a membranous vitreous and it is seen in type 1 Stickler syndrome. Now, another phenotype that is associated with the type 1 Stickler syndrome is the presence of empty vitreous cavity. So sometimes there might not be any vitreous at all. Okay, now another phenotype that you see, and it is usually seen in Stickler syndrome type 2, in which the mutations occur in the collagen 11A1 gene, is the presence of a beaded vitreous. So I'm so sorry for this typing error here. So in type 2 Stickler syndrome, you are going to see basically a beaded vitreous. So what is meant by the beaded vitreous? So over here you can see the strands of fibers and you can see small beads on top of them. So that is known as a beaded vitreous. Okay, so this basically tells you how important your type 2 collagen is, because deficiency of that or dysplastic collagen in patients with Stickler syndrome leads to dysmorphic or dysplastic vitreous, and this vitreous is unable to provide tamponade to the retina, and therefore these patients are at a greater risk of developing giant retinal tears as well. Okay, so I hope that is clear. So moving on. So we discussed about the constituents of vitreous, and now we will talk about the topography of the vitreous. Okay, so the vitreous, as I told you, the vitreous cavity or the vitreous humor is situated behind the lens and in front of the retina. Now the vitreous is shaped like a sphere except in the anterior space where it has an anterior depression. So you can see over here, this is the anterior depression. Now this anterior depression is known as the hyaloid fossa, patella fossa, or it also can be called as a lenticular fossa because your lens sits in that fossa, right? So that is important. Now, apart from that, there are various parts into which the vitreous can be divided. So we have the hyaloid layer, also known as the membrane, and based on the location or the part of the vitreous that we're talking about, you have anterior and the posterior hyaloid membrane. Then we have inner to that we have the cortical vitreous, and inside of the cortical vitreous we have the medullary vitreous. So from outside to inside you have the vitreous membrane, then you have the cortical vitreous, then you're going to have the medullary vitreous. So as you can see over here from this diagram, you will have the most outward thing which is labeled here in white color is the hyaloid layer. Then in green what we have is the cortical vitreous, and inside that we will have what is known as the central vitreous or the core of the vitreous, which is the medullary vitreous. Okay, now I told you that the hyaloid layer can be classified or can be again divided into the anterior and the posterior hyaloid membrane. The anterior hyaloid membrane basically is the part of the membrane which is situated over here near the lens and near the vitreous base. Okay, so it is situated mostly in the anterior location. So vitreous base is actually a part of the vitreous which is situated near the ora serrata. So I will talk about the vitreous base also in detail. Okay, so stay tuned for that. But for now, know that till this level of the vitreous base, you have what is known as the anterior hyaloid membrane, and posterior to that, what you have is known as the posterior hyaloid membrane. Now, there are some attachments with which the vitreous or the anterior hyaloid membrane is going to attach with surrounding structures. Now, let us see what are those attachments. So, the first attachment that we have is with the lens, and this is known as the retrolental ligament or the ligamentum hyalidocapsulare. Okay, so basically what does it mean? That there is an attachment between the anterior hyaloid membrane and the posterior capsule of the lens. Okay, so this is known as the retrolental ligament or the ligamentum hyalodocapsular. Okay, this is also known as by another name, which is known as the Weger's ligament. Now, the second attachment is known as the hyalociliary zonules. Now, the hyalociliary zonules are nothing but they are the fibers which are extending from the anterior hyaloid membrane, and they go and attach into the valleys of the ciliary processes. So these are the ciliary processes, and you can see within the valleys of the ciliary processes you will have these hyalociliary zonules. Apart from that, we have coronary ligament. Now, coronary ligament basically is something which attaches the hyaloid membrane to the inner part of the posterior one-third of the ciliary processes. So, this is ciliary processes. So, coronary ligament attaches the anterior hyaloid membrane to the posterior one-third part of the ciliary processes. And finally, you have the median ligament, which is going to attach the anterior hyaloid to the mid zone of the pars plana. Okay, so what is pars plana? We know that ciliary body has two parts. It has a part which has ciliary processes known as the pars plicator, and from the pars plicator you're getting hyalociliary zonule and the coronary ligament, and then you have the pars plana, which is the posterior smoother part, and from there you have an attachment to the anterior hyaloid, which is known as the median ligament. So I'm so sorry for the typing error here. Ligament spelling is Ligament. Okay. So I hope that is clear. So anterior hyaloid membrane has these various attachments which are responsible for keeping the vitreous over there. Right. So these are the anterior hyaloid or anterior vitreous attachments. Now, what is meant by posterior hyaloid? The posterior hyaloid membrane basically comes from the ora serrata and it reaches up to the optic disc. The part of the hyaloid layer from the ora serrata right up to the optic disc, or from the vitreous base right up to the optic disc, is known as the posterior hyaloid membrane. Now, you might be thinking what exactly is meant by this posterior hyaloid phase. So, to tell you, the term posterior hyaloid phase is actually used for the detached posterior hyaloid membrane. So when the posterior hyaloid membrane, which is in close association or which is closely attached to the retina using the laminin and fibronectin, when that gets detached from the retina, that is known as the vitreous detachment, and that detached posterior hyaloid membrane is known as the posterior hyaloid phase. So over here you can see that this is how it is detached here, and it has lifted from the retina, and now this hyperreflective line you can call it as the posterior hyaloid phase. So I hope that is clear. Now, we finished discussing about the hyaloid membrane, and next we are going to move slightly inside and we'll talk about the cortical vitreous. Now, the term cortical vitreous applies to almost the entire peripheral zone of the vitreous, drawn over here in green color, and the thickness of this periphery is about 100 microns. Okay. Now, a special thing about the cortical vitreous is that it has more condensation and a more fibrillary architecture. So what I mean to say is the amount of collagen that is present here is more, and moreover that collagen is also more condensed compared to what you see in the medullary vitreous or the central vitreous. Okay, so you have a more condensed and fibrillary vitreous in the cortical region. Apart from that, you also have some special cells which are present in the cortical vitreous, which are known as hyocytes. Now, let me tell you what I mean over here. The hyocytes are also present in the medullary vitreous also, but the hyocytes are present in greater number in the cortical vitreous. Now, although the cortical vitreous has a very small volume, it actually forms the metabolically very active part of the vitreous. And the reason for that is again because it contains these essential cells which are hyocytes. Okay. Now, apart from that, they also contain other cells like the fibrocytes and the glial cells. Now, let us talk about the cells of the vitreous, and over here we shall be focusing basically on the hyocytes. Now, essentially, the vitreous does not have so many cells compared to the other structures, okay, of the eye. Like in retina, you have a lot of cells which are forming these layers. But in vitreous, essentially it is cellular, specifically the medullary region. But the other types of cells that you do find are the hyocytes. Okay, so these hyocytes are seen in the cortex. They are seen near the vitreous base, they are seen near the optic disc, and also surrounding the optic vessels. Morphologically, if you observe these hyalocytes, and even immunophenotypically, they are quite similar to those of the macrophages. Okay, and they have these numerous phagolysosomes in their cytoplasm that you can see, and this indicates that they have these macrophages like function to them. Okay, so again, over here is the human hyocytes pictures. So the first one over here you can see, this is actually present in the posterior vitreous cortex, very in close proximity to the internal limiting membrane, and this image is that of the electron microscope. And as you can see, the hyocyte is exhibiting classic characteristics of cells of the macrophage lineages. They have the lysosome-like granulae, they have mitochondria, they have these pinocytic vacuoles, okay, through which they are basically going to catch the foreign agents and ingest them within their cytoplasm. And apart from that, the second picture is that of, again, a scanning electron micrograph, which is showing hyocyte, and it's actually showing how hyocyte is nicely entangled within the collagen meshwork surrounding it. Okay, so that is hyocytes. Now, there is a controversy regarding the role of hyocytes in the vitreous synthesis. Now, in vitro, that means in experimental conditions, it has been shown that they definitely produce vitreous constituents. However, their role in the synthesis of vitreous is still controversial in vivo. Okay, or in vivo, you can say. Now, apart from that, the hyocytes are believed to contain large amount of Golgi apparatus and smooth endoplasmic reticulum, and they are negative for glial cell markers. That means they are not similar to the glial cell, and instead they are more similar to the macrophages. Now, over here is important clinical nugget for you. So, as I told you that the vitreous essentially is acellular, and whatever cells you find, you will have them occasionally near the vitreous cortex, near the optic disc margin, and sometimes near the retinal vessels. However, there are some conditions, pathological conditions within the eye, when you might actually see a marked vitreous cellular infiltrate, where the population of the hyocytes actually increase, and this happens usually in the inflammatory processes in the adjacent tissue. So whenever you have inflammation of the retina or the choroid, the inflammatory cells within the vitreous are actually going to rise, and this will give you the cellular infiltrate that you see. Like for example, over here you can see these numerous dots in the posterior vitreous cavity. That is basically nothing but the numerous vitreous hyocytes or vitreous cells, indicating that there is a component of vitritis, or we can say there's a component of inflammatory cells. And you can also see this bump over here, indicating that you're actually dealing with some uveitis condition, and because of that, the vitreous cells or the inflammatory cells have actually spilled inside the vitreous cavity, and that is what you're seeing on your OCT, right? So similarly over here, you can see that usually behind the lens, you're not going to see any vitreous cells. However, here you can see a lot of vitreous cells behind the lens, or behind the posterior surface of the lens. Okay. So there are so many roles of hyocytes. Hyocytes actually play an important role in the development of the vitreous. As you know, the primary vitreous, we discussed about this in our previous video on vitreous embryology. The primary vitreous, the hyaloid vasculature, basically is coming from the hyocytes. Apart from that, hyocytes also are playing a great role in the involution of the primary vitreous. They have a role in metabolism. They have a role in disease also. They act like macrophages. They can have inflammatory markers. They can actually act as antigen presenting cells, and they also have a role in surveillance. Okay, so they are basically acting in metabolism. They're acting in development. They're acting in disease, and also in immunological processes. So although we have very few hyocytes, they do play a very important role in the vitreous. Okay, so we talked about the primary, secondary, and tertiary vitreous in our previous video on vitreous embryology and disorders. And if you're interested, I'm going to provide the link in the description box. Okay, so coming back to the discussion, let us also talk about a very important question that is asked, and that is, what are the sites where the vitreous is really strongly attached? Okay, and these sites are near the peripheral retina and the pars plana, and this occurs basically in the region of vitreous base. We'll talk about what is meant by vitreous base in a while. Apart from that, the posterior lens capsule. Remember, we talked about the V-girt ligament or the ligamentum hyaloid capsulare. Now, this is the position where the vitreous is really strongly attached to its surrounding structure, right? So, obviously, before we were talking about the attachments of the anterior hyaloid membrane to the ciliary body, to the pars plana, and to the lens capsule. Definitely those attachments exist, but here we're talking about the strong attachments or the dense attachments of the vitreous. And one is the peripheral retina and the pars plana in the region of vitreous base, and the second one is the posterior lens capsule. Apart from that, the vitreous is densely adhered to the margin of the optic disc at the base of the hyaloid canal, and also it is attached to the internal limiting membrane of the retina, especially where there are retinal vessels. Right now, this attachment to the retinal vessels is actually the most variable and the weakest of its attachment. So the first strong adhesion of the vitreous that we are going to talk about now is in the region of the ora serrata, and that is the vitreous base. Okay, so over here this is actually a section of the eyeball, and you can see over here if this is actually your cornea, and over here this is your ciliary body, and you can see that the anterior part from where you're going to have the ciliary processes is known as the pars plicator. The posterior smooth part is called the pars plana. Right now, from behind the pars ciliary body, what starts is the retina. The anteriormost part of the retina is known as the ora serrata. At the point where the retina is basically connecting to the pars plana, that is known as the ora serrata. Now, a portion of the vitreous basically straddles this ora serrata and the pars plana region, and that 3D structure of the vitreous, or that part of the vitreous, is known as the vitreous base. Right, so vitreous base is basically a three-dimensional zone. It is about 4 millimeters in width. It is present all throughout. So this is just a section of the eyeball. You're going to have all these structures 360 degrees. Right, so vitreous base is also that 4 millimeter wide zone of the vitreous, which is firmly attached to the region of the ora serrata. Now, if you actually have to go into the details of the vitreous base, you will notice that anteriorly, the vitreous base extends to about 1.5 to 2 millimeters into the pars plana region, whereas posteriorly, it actually extends to about 2 millimeters to 3 millimeters. So when you go nasally, it extends 3 millimeters into the ora serrata, whereas if you go temporally, it extends only about 2 millimeters into the ora serrata. So what can we say? We can say that the vitreous base is much more wider nasally because it is extending more posteriorly on the nasal side of the ora serrata than on the temporal ora serrata. Okay, so that was regarding the dimensions of the vitreous base. Again, another diagram. You can see over here the pupil. Then this is your iris. Then over here is the pars plicator. Then the pars plana. Okay, and then here is the ora serrata, and then okay, of course you have posteriorly the retina. Right, so this image or orientation is as if you're looking from on top. You have the posterior structures, and then on the bottom you have the anterior structure. Now obviously on the inside you have vitreous cavity, or which is holding the vitreous humor, and the dense part or the condensation of the vitreous near the region of the ora serrata, like this 360 degrees, is known as the vitreous base. So I hope that is clear. Right now, another thing that I want you to know regarding the vitreous base is the orientation of the collagen fibers. Now, at the vitreous base, the collagen fibers basically coming from the cortical vitreous, they get inserted at the internal limiting membrane of the retina at almost about 90 degrees angle. So you can see over here they are inserted straight at the internal limiting membrane, whereas posterior to the region of the vitreous base, if you go, you can see that the collagen fibers are going to become more parallel. Okay, so they're not at right angles as in the region of the vitreous base, but they are more parallel to the surface of the retina. Maybe this is the reason why we have dense adhesions at the vitreous base as well. Okay, so in the posterior part, the collagen fibers are nearly parallel to the internal limiting membrane. Now, so since I talked about this dense adhesion of the vitreous base, I would like to present to you a clinical nugget, which is the vitreous base avulsion. So over here, it is so important to understand that the vitreous is so densely adhered at the ora serrata region and the pars plana region that it is actually believed that it is almost impossible to separate the vitreous clearly from the pars plana region and the ora serrata region. Something similar, something what happens in the posterior vitreous detachment. So what happens in the posterior vitreous detachment is that the posterior hyaloid layer or the membrane is going to cleanly come off from the internal limiting membrane. However, that doesn't happen in case of vitreous base. The vitreous base, there is so dense adhesion between the internal limiting membrane and between the region of the pars plana and the vitreous base, that whenever there's a traumatic detachment of the vitreous base, along with the vitreous, the epithelium of the ciliary body and the retina are also going to be detached along with it, and that is what is known as vitreous base avulsion. Okay, so in vitreous base avulsion, along with the vitreous, the portion of the ciliary epithelium and the retina are also going to get detached, right? This happens in trauma. Now, coming to the next strong adhesion of the vitreous, and that is the Weigert ligament, and also known as the hyalodocapsular ligament. Okay, another name for the Weiger's ligament is the Egger's line. Okay, because it is present behind the lens, it is known as the retrolental ligament as well. Now, it is again a strong adhesion between the vitreous and the posterior lens capsule. So, if the outer circle over here represents the patella fossa, the inner circle over here, which is usually of about 9 millimeters diameter, represents the circular adhesion between the vitreous and the posterior lens capsule, and this circular adhesion is known as the Weigert ligament or the Egger's line, right? Now, another important point I want to tell you is that you can see the space, which is, there will be a space that is formed between the Weigert ligament and the posterior lens capsule, and that space now is known as the Berger's space or the Ergelet's space. Okay, again, let's try to understand this from this diagram. So here you have the vitreous. The vitreous has an anterior depression. That anterior depression in which the lens sits is known as the patella fossa. Then over here you have the circumferential attachment between the vitreous and the posterior lens capsule, which is known as the Weigert ligament or the Egger's line. Now, between the Weigert ligament and the posterior lens capsule, again there's a potential space, or you can say that the Weigert ligament is actually dividing the patella fossa into an inner space and an outer space, and that inner space is known as the Berger's space, right? So within that circle of the Weigert's ligament, there lies a potential space of non-adhesion between the vitreous and the lens, and that is known as the space of Berger or the Ergelet's space. I hope that is clear. Apart from that, you should know that there is no basement membrane between the vitreous base and the lens, and therefore this area is known as the annular gap. And it is actually important because it allows for easy diffusion of ions between the aqueous and the vitreous compartment. Okay. Now, I told you that another area where the vitreous is attached is near the area of the optic nerve head, and another important clinical aspect of this is that with age what happens is the vitreous starts detaching from the retina. Okay, and the firm attachment of the vitreous with the optic nerve head will also loosen. Now, as the vitreous detaches completely from this peripapillary area, that is the area around the optic disc, it becomes visible clinically as a partial or a complete annular ring, and this ring is known as the Vogt's ring or the Weiss ring. Okay, now let me tell you, if you want to actually observe these rings on slit lamp, you have to slightly defocus. That means you have to basically take your joystick and move it slightly towards yourself. First, focus on retina. As you're focusing on the retina, you won't be able to see the Weiss ring because the Weiss ring is situated anterior to the retina. So if you want to focus on the Weiss ring, you basically have to defocus from the retina and move your joystick slightly towards yourself so that you're focusing anterior to the retina, and then you will see this annular or partial or completely annular ring, which is the Vogt's ring or the Weiss ring. So we finished talking about the vitreous cortex, the vitreous base, and also the various other attachments of the vitreous cortex with the surrounding structure. So at this point, let me introduce you to two important concepts, and these are vitreous detachment versus vitreoschissis. So what is the difference between vitreoschissis and vitreous detachment? So when the vitreous cortex or the vitreous membrane, sorry. So when the posterior vitreous membrane, also known as the posterior hyaloid membrane, it gets completely lifted off from the internal limiting membrane of the retina, that is known as the vitreous detachment. However, sometimes there will be a plane of cleavage that develops within the vitreous cortex. That means there's a cleavage which is occurring within the vitreous cortex, resulting in these two hyperreflective lines that you see on the OCT. Okay, and this is known as vitreoscheisis. So vitreoscheisis is not really the complete detachment of the vitreous, but here the split is occurring within the layers of the cortical vitreous, and therefore you see these two hyperreflective lines on the OCT, and this is known as vitreoscheisis. Okay, so I hope that is clear. So moving on, now we shall talk about the innermost part of the vitreous, and that is the medullary vitreous. Okay, now the medullary vitreous, as you can see, it forms the majority of the vitreous mass, and it has a slightly less fibrillary arrangement. That means the collagen is not as densely packed as in the cortical vitreous over here, and also essentially it is believed that it is cell free. If at all you're going to see hyalurocytes, a very few hyalurocytes will be seen over here. And also it is believed that it contains the cloacaed canal, although some people believe that there's a doubtful existence of cloacaed canal in adults. Now, when we talk about the medullary vitreous, there are two schools of thought regarding its structure. Now, some believe that maybe the medullary vitreous is membranous in structure. That means it has this onion peel-like appearance. And another school of thought talks about the vitreous or the medullary vitreous to have cisternal arrangement. That means it is believed that it has various fluid-filled lacunae within it. So which one is true? Let's talk about it. So the first school of thought says that the vitreous actually has this lamellar appearance to it. That means the fibers are arranged like this, giving it an appearance of this, what is known as an onion skin appearance. Now, this onion skin appearance basically occurs because of the presence of tracts and zones within the vitreous. Okay, so this school of thought basically believes that there are some tracts going from anterior to posterior region of the vitreous, and these tracts basically divide the vitreous into various zones, and because of the zones the vitreous appears as if it is like an onion skin. Okay, so that is the membranous school of thought. Let us talk about these tracts first. So you have these four tracts majorly. You have a tract which is coming from the posterior surface of the lens, known as the retrolental tract. Then you have a tract which is coming from the posterior part of the ciliary body, known as the coronary tract, which is going to come from the ciliary processes. Then you have a median tract which is coming from the region of the pars plana, and then you have a pre-retinal tract which is coming from the ora serrata, right? Now what you can remember is that the thicker ones are the retrolental tract and the pre-retinal tract. The coronal and the median tract, which are the middle tracts, they are not as prominent as the other two, right? And therefore, when it comes to dividing the vitreous into zones, we basically consider only two tracts. One is the retrolental tract, which is coming from the posterior aspect of the lens, and the other one is a pre-retinal tract, which is coming from the ora serrata. Okay, now these tracts are going to divide the vitreous into three zones, and these zones are namely the retrolental zone, which is the zone situated right behind the lens. The middle zone is known as the intermediate zone, and the zone outside the pre-retinal tract is known as the pre-retinal zone. Okay, so this is given in some of your textbook, and that's the only reason I'm mentioning about it. Okay, so this was regarding the membranous appearance of the vitreous, but there's another school of thought as well, which says that the vitreous actually has these cisterns inside it, and this is known as a cisternal morphology or anatomy of the vitreous. So the main scientist who actually talked about it was the Wurst, and Wurst basically envisioned a much more complicated structure regarding the vitreous. He believed that there are actually 36 retrociliary cisterns. So let me first try to clarify them. So first we have some cisterns which are present behind the ciliary body. These are known as the retrociliary cisterns. Then we have some cisterns which are present near the equator. So these are called equatorial cisterns. So this in yellow is the retrociliary. Then near the equator in cream color or skin color you have the equatorial. Then in pink color what you have near the macula are the perimacular cisterns, right? Now, accordingly, they believe that there are about 36 retrociliary, 72 equatorial, and 12 perimacular cisterns. And of course, you have another nice cistern which is present just in front of the macula, which is known as the premacular bursa. Okay, and this premacular bursa is connected to one of the retrociliary cistern through this connection, which is known as the canalis cilio-bursale. Okay, now, apart from that, you have the cloacaed canal as well, which we talked about in detail in the first video on anatomy or the embryology of the vitreous. So, you have this cloacaed canal which has a dilatation anteriorly, and posteriorly also the cloacaed canal has a dilatation which is known as the area of Martigiani. Okay, so I hope that is clear. Okay, so that's briefly about the cisternal anatomy of the vitreous. Okay, now it's believed that all these cisterns and bursa, they actually have a potential to intercommunicate with each other. Now, the previous school of thought said that. Now, over here, let me just try to make it clear what this diagram means. So, over here, you have the lens, and consider this to be your cloacaed canal, which is running behind, and the cloacaed canal ends into the area of Martigiani near the optic disc. And here, you have this very important bursa, which is near the macular area known as the premacular bursa. Now, initially, it was believed that they do not really connect with each other, but now it is known that these bursa are actually in the shape of a mitten. So, the thumb of the mitten is formed by the cloacaed canal in the area of Martigiani, and the other four fingers are formed from premacular bursa, right? So there's actually a free communication between the two. The cloacaed canal is actually communicating with the premacular bursa as well, right? Now, another clinical nugget here is regarding the premacular bursa. It's a very important bursa. Remember, sometimes you can see it in OCTs as well. So you can see this hyporeflective space anterior to the macula. This is known as the premacular bursa, optically empty structure. Now, it is also called as the posterior precortical vitreous pocket. Okay. Now, it is believed that it decreases the tractional forces generated during the ocular motion, and that is basically the function of premacular bursa, right? So, that brings us to the end of this video. I hope it was useful. I hope it made sense. And that's all. Thank you and have a nice day.